Hi, I'm Jamie Sue. I'm the special care nursery educator, and today I'm going to teach you how to do a newborn assessment. So the purpose of the newborn assessment is to make sure that our baby, seems healthy, they're breathing, they're active. We don't have any abnormalities that we would need to notify the provider about. And just essentially reassuring the parents, especially first-time parents, that their baby is okay. So your assessment does not have to be done on the warmer. It can be done on mom's chest while she's doing skin to skin. You can start out with your general assessment, again, just making sure baby's breathing, they're pink, they're active. Then you can do your more head to toe assessment and get your measurements after that hour of skin to skin. So when we're starting, baby's been born, you're drying, you're just kind of getting your general appearance. And I should say first thing, before you do this, you will do your hand hygiene and wear gloves, but for this demonstration, I'm not wearing the gloves. So you're just going to check your general appearance. Is baby breathing? They're crying? They look pink. They may be a little bluish at first, but they will pink up. At least that's our hope. You're going to check the color of the skin. Do they, maybe their hands and feet are still a little bluish, but the rest of them are nice and pink. There's no jaundice. Are they pale? Is their skin normal for ethnicity? So as long as all of that is good, we're going to also check their skin, make sure, they may be covered in Vernix, that cheesy material. If they're born premature, you may notice some hair on the body. Just assure the parents that that will disappear. Are they active? Are they moving everything? Want to make sure, if we had a shoulder dystocia, that the baby's moving that arm. You also be checking reflexes. Are they grasping your finger, your Babinski, where you go up the foot? Do they splay the toes? Are the toes going down? And the very first test the baby is going to get is that APGAR score. You're going to be scoring in the first minute and at 5 minutes. And this is just based on their activity. Is their heart rate greater than 100? Are they crying? Are they, when you touch them, they react to you. And in the PowerPoint, you'll see what the assessment criteria is. So getting into the head to toe assessment, we're going to start with the head. So when you're feeling the head, you're going to notice kind of a diamond shaped anterior fontanelle, and the sutures, which should be either going to be closed, approximated, or they could be overlapping. And going back to the posterior fontanelle. And these should feel soft. They may be flat. You don't want them to be bulging. If the baby's crying, they may be tense or bulging, but if the baby's nice and calm, they should be flat and soft. If you notice that your sutures are fused or you're not feeling the fontanelles, you're going to need to notify the provider. We're looking at the shape of the head. Is it symmetrical? Is there molding? Has the baby been in the birth canal and we've got that nice big cone head? Just assure parents that will flatten out. You're also going to check the head, because especially if they had like a vacuum delivery, they may have what's called a cephalohematoma, which is a bump on the side of the head that doesn't cross the suture lines. Or does their head feel kind of boggy, or there's fluid moving around that does cross those sutures? That may be a caput. And again, those are most things they're going to heal on their own. Parents may be a little concerned, but just let them know that it does. The baby, we'll keep an eye on the baby, but the baby's going to most likely be fine. When you check the face, we want to make sure that we have 2 eyes, that they're symmetrical. Do they open? Are they fused? Your real premature babies may have fused eyes. Are they opening, closing? Your ears, are your ears symmetrical? Are they low set? Your ears should not be below the corner of your eye. and there's no, you don't want any skin tags. You're also going to check your nose. You got 2 nares. If they're crying, they're breathing, you know, they're probably patent. If for some reason the baby's crying and then all of a sudden stops, starts to turn blue, they could have a blockage. So we would definitely call the special care nursery, the provider, over for that. Your lips, are they pink, moist? The tongue, is the tongue moving? Is there a little tongue tie, which is where there's a little piece of skin, the frenulum, that may attach at the tip of the tongue instead of more towards the back, holding that tongue down, which could cause feeding issues. Do you have a cleft lip, cleft palate, which is just where the lip and the palate didn't close together? And just making sure that, you know, do we have a recessed chin, that little tiny chin that goes back? Some of these things you may notice, oh my goodness, this baby looks kind of funny. Is this part of a syndrome? Like, you know, trisomy 21, where you have the wide set eyes, the big protruding tongue. Or take a look at your parents. It's like, oh, baby looks just like the parents. Next, you're going to go down, make sure, you know, you don't have any webbing of the neck, extra folds. You're going to check your clavicles, your breastbone, just making sure everything, you know, is intact. Baby's able to move. You don't feel like anything is broken out of place. Check your chest. We'll go on to baby that has a little more definition here. So, you know, you should have 2 nipples. When the baby's breathing, are they pulling in? Do they have retractions? Are they using those muscles to breathe? That is not normal. You'd want to call the provider. Sometimes some babies have breast buds, or you may notice a little drainage, a little milk, and that's just from mom's hormones. Coming down to the abdomen, is our abdomen nice, soft, rounded, flat? It shouldn't be really distended and tight. It should be nice and soft. Belly button, your umbilicus, the cord, is it a 3-vessel cord? Make sure that we don't have any bumps or protrusions in the cord. That could be intestine that's coming out. Just make sure that, again, everything is closed. You don't have any bumps, bruises, scrapes, marks. We're going to go on down to the groin. You can see here we have a little boy. We're going to check our femoral pulses, which we'll make sure that we're not having any issues with perfusion, the blood going down. With males, you're going to check, hey, do we have, you know, the genitalia, penis, do we have a hypospadias? Is that meatus centered? Check our testes distended, descended. Do we have a hydrocele? So make sure that everything is good there. Also, here, per our policy, we do check a rectal temperature at birth to check that we do have an anus and it's patent. If not, if you don't notice anything, that would definitely be something to notify the provider. Do be careful when doing the rectal temperature, because if you go in at about 3 centimeters in is where the intestine starts to turn right. So we don't want to perf that. And also, if you have a baby that they're thinking has a heart condition, you don't want to do a rectal temperature. Just go ahead and do an axillary temperature. And then we're just going down our legs, our feet, make sure we don't have any extra toes or missing toes or fused. I did miss up here. We'll make sure that we have 10 fingers, 10 toes. We're not overlapping. We go to our back, make sure that our back is nice and straight, that there's no protrusions, tuft of hair. That's our little boy mannequin. When we're going with the girls, when you're doing your genital assessment, you make sure that she's everything looks symmetrical. You may notice some swelling which is perfectly normal. And again, also make sure the anus is patent. And we talked about reflexes. If you notice when the baby's laying down, they kind of startle, or you pick them up and they kind of give that little scare startle. That's your Moro reflex. Your hips, you want to check and make sure that they're in place, that you would take the legs, kind of go up and down, make sure they're not going to displace, that your creases are symmetrical, that your legs are the same length. And also part of your assessment, you're going to get the measurements. You're going to get a weight on the baby, head circumference, chest measurement, abdomen, and your length. So that is the quick down and dirty head to toe assessment. Should really only take you a few minutes to do. I will be sending out a PowerPoint that has some more details and shows you some things that are abnormal that you may find. And if you have any questions, don't hesitate to come find me.